Next, we will be having Augustin Vannier from University of Chicago present the evaluation of graphic narrative patient education tool to reduce pre-treatment anxiety for patients receiving radiotherapy in a Latin American hospital.
Yes, thank you so much for the introduction. My name is Augustin. I'm a second-year medical student, and I'll be talking about our work in Colombia using the CBRI guide to reduce patient anxiety there. Okay. Oh, excuse me. There's a slight lag. So why would patients be worried about radiotherapy to begin with? Well, many of the physicians there will know better than I that frequently patients will arrive with fairly negative associations with radiation in general. Things like nuclear disasters and the like, which hardly puts them at ease. But then adding to that is the fact that the process of radiotherapy is fairly complicated. It's a complicated treatment modality, and so patients may have a low familiarity with how the treatment is going to work, which can then compound that baseline anxiety. Now, that anxiety that patients arrive with does matter because not only can it lower treatment adherence for the patients, but it can also cause greater discomfort during treatment. Anxiety is it's unpleasant in and of itself, but can also increase patients' discomfort with the secondary effects of radiation. So addressing this anxiety is one of the priorities of patient education. One of the issues is that the text-based guides are very often quite complicated. Oh, excuse me. Are quite often complicated. They have low readability. They use very technical language. It's also a form of passive education. So patients will usually take these guides home and then go over them on their own and be unable to ask follow-up questions of their physician. When they have images, they typically don't correlate to the text. And they're also mostly available in English, which obviously limits their accessibility to non-native English speakers. And so enter the CBRI guide, which is a graphic narrative discussion guide designed to illustrate rather than only explain in words the process of radiotherapy. This is taken from the CBRI in Espanol guide, this image here. It's therefore designed to increase the accessibility of information about radiotherapy for the patients. It's an active form of education as well, so it's designed to be used by the radiation oncologist or another healthcare professional in discussion with the patient so that they can bring up any questions as they arise. Both providers and patients do rate this as, or they perceive some benefit in this guide, at least in the English version, and it has subsequently been translated into Spanish to improve its accessibility, both domestically and abroad. So there, 13% of American residents are native Spanish speakers, but also there's this huge population of Spanish speakers worldwide for whom this translated CBRI guide may increase the accessibility of radiation oncology education. Now, one thing that we wanted to test was whether this guide would work not only in a different language, but also in a different country and therefore cultural context. And we were very fortunate to find some collaborators in Colombia, which is a middle-income country with universal health insurance and therefore theoretically universal access to radiotherapy, but very unequally distributed radiotherapy centers in the country. So this is a map of the number of radiotherapy centers by region, and you can see that there are large swathes of the country with relatively limited access. That means that patients there have to travel for their treatment, which can limit the access even though the travel and stay is paid for by their insurer. Now, our collaborators are at the Centro de Tratamiento y Investigación sobre Cáncer in Bogotá, Colombia, in the center of the country there. It's a comprehensive cancer center opened in 2022 with a very large capture area because patients so frequently have to travel for their care. That means that they receive a mix of urban and rural populations with a wide range of educational attainment and socioeconomic status. So it's an ideal study environment for the deployment of CBRI. The objectives of our study were first to establish the level of pretreatment anxiety in patients initiating radiotherapy in Bogotá, and then to conduct a single-arm field test of the CBRI in Espanol guide to evaluate any possible reduction in anxiety associated with its application. The hypothesis primarily was that following graphic narrative education, patients would report lower anxiety than they did at baseline. And so we included all patients who had a cancer diagnosis for a solid tumor who were initiating radiotherapy at CTIC. And we excluded any patients under the age of 18, any who had previously received radiotherapy, or any who were unable to consent for themselves. Now, the procedure consisted of a 30-minute session in which we consented and then conducted an initial survey where we collected the demographic information of the patients and then also a baseline anxiety test. A nurse then applied the CBRE education, and then the patient's anxiety was reevaluated again using the STI SF, which I have a few more details about here. This is an image of what that anxiety questionnaire looks like. It's a 6-question form in which patients agree to varying degrees with statements like, I feel tense, I feel content. That can then be converted into a linear score, which can be used to compare their pre and post CBRE anxiety. That is represented here. So in this graph, we represent all patients recruited for the study, all 94 to date. And in all of in their cohort overall, we saw a mean reduction of 5.35 on the STI SF across the CBRE intervention, which was a significant difference. And when we zoomed in on patients who had a moderate or high anxiety level at baseline, which is to say those who are a priority for CBRE education, we actually saw that this change this reduction in anxiety doubled. And this was clinically significant in the sense that patients with this moderate or high anxiety at baseline, the median patient began with a high level of anxiety. These are using reference valuables common in the STI literature, and ended after CBRE with a low level of anxiety. So we saw a clinically significant reduction in anxiety in this group. We also wanted to confirm that patients with low anxiety at baseline would not experience any increase in anxiety. So would it be possible to overeducate patients who are not particularly worried about therapy at baseline? And the answer is essentially no. There was no significant increase in these patients' anxiety, and so we therefore consider CBRE safe to apply to all comers, so to speak. We also wanted to investigate whether there may be some skew towards a certain whether this effect would be skewed towards a certain level of education. And so here we divide patients into 3 different sort of categories of educational attainment. And interestingly, we find that there are remarkably similar differences in anxiety across the CBRE intervention in all 3 levels of education. And so therefore, we conclude that it's an appropriate intervention regardless of the patient's educational attainment at baseline. Limitations of the study are that it's a single-arm trial. Patients may experience demand characteristics and social desirability bias, and currently we only recruit at a single study site. And we conclude that in our cohort of patients initiating radiotherapy in Bogota, the anxiety was lower following CBRE education than at baseline, and that this was particularly significant in patients with clinically significant anxiety initially. I'd like to thank my Chicago mentors very much, and then also our international collaborators at both CTIC and the INC, where we're about to begin recruitment at a second study site. Thank you all very much.